This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning, this is Heiko from Acupuncture on Air, where every Tuesday at 11 a.m. on Radio Kidnappers we interview acupuncturists from around the country. Today we're continuing our thread with Sarah Molony and talking about women's problems. Good morning, Sarah, how are you?
Good morning, very well, thanks. Thanks for having me back on the show.
No, that's okay, it's a pleasure to see that you're here and you're eager. I think what, the general population, everyone knows acupuncture treats pain, it's used for back pain, it's used for headaches, and there's a slow sort of education going there that people are becoming aware that it can be used for many other conditions, such as like last time we spoke about fertility, and today, we're just getting on about talking about the different problems with pregnancy that we can do. Can you tell us, say, with you and with the what was happening there, Ken? Ken's pointing to me. What's happening?
Your bracelet's making a big noise.
Oh, my bracelet's making a big noise. All right, so sorry about that. The people out there in YouTube land. Now, Sarah, just tell us about the patients that you get. Are they coming like from word of mouth, or have they read something somewhere, or are you getting referrals from midwives, doctors, or a mix of everything?
It's been a little bit of a combination. Most of my patients who come to me from pregnancy have heard about it from a friend. Very, very commonly they will come in for morning sickness.
Yep.
And it's because their friend said it really worked for them and they'll try anything, so they'll come in. That said, though, if you go and speak to your local midwife as an acupuncturist, it's quite helpful, because I had this experience last year. I went and spoke to them, and they were very much unaware, at least in my local area, as to all of the things that acupuncture and traditional Chinese medicine can offer pregnant ladies. And they were really surprised and excited that there was something that we could offer. And so since speaking to them, it's made a world of difference for me in getting the word out to preggy ladies, and they've all been coming into the clinic. So a little bit of both.
What about with the
as well as another one?
breech baby? That's again, it's a condition or complaint that many women have suffered. Can you tell us a bit about that, and how it works, if you can, and what sort of treatment it is?
It's one of those magical things that still floors people. So what we do with our traditional Chinese medical treatments, if a woman's baby is not in the correct position, we call that breech. And we've discovered over thousands of years that if you take a traditional Chinese herb called moxa, and it's also known as mugwort, and it comes in lots of different forms, but normally for us comes rolled up like a cigarette, and in my case I use smokeless moxa, so it's mixed with charcoal, it just looks like a black cigarette. And you light the end of it and you hold it over the tip of the mother's little toe. And you do that on both of her little toes for 20 minutes on each side. And it's an amazing process, and it sounds really bizarre that burning a herb by somebody's toe will make the baby turn, but it really does.
Yeah,
so
I know, and I know it has this reputation. It's what China's has one of these empirical points. It's just been used and it's just worked over and over again.
Works. It's a wonderful thing. So usually it takes a few treatments. Not everybody will need a few. So I've had some people that have one treatment and boom, baby has moved.
Yeah.
But it is something that usually happens later on in the afternoons or the evenings, and it can take a few days to happen. So what happens is I will get patients to come in. I'll work out what's going on, because constitutionally we all have little irregularities and imbalances. So I will treat them constitutionally and give them the moxa on their toes. Sometimes, depending on what's going on, I might needle that point as well. But then I give the patient moxa with a take-home sheet as to how to use it, and then they are instructed for a 10-day course to either apply it themselves or get somebody else to apply it with very strict safety instructions to help with baby moving. And it's wonderful because it actually gives them something they can do. So a lot of women during pregnancy feel like there's nothing that they can do. It's out of their hands.
Yeah.
Whereas this gives them a little bit of control, which I think is a really good thing, and it works.
Now, what about some of the other conditions that you can get during pregnancy? Do you want to tell us about a few of those and which ones respond well to acupuncture?
All sorts. So very commonly women will come to an acupuncturist, in my experience anyway, often when they've tried a lot of other things. And unfortunately, Western medicine doesn't always hold the answers for pregnant women because there are drug interactions between the drugs and the fetus, or because mums are very much sensitive when they're pregnant, they can't always take things that they would normally take anyway. So there's a little bit of a lack as to what people can do for pregnant women, but traditional Chinese medicine often has a lot to offer. So some of the more common things that I address would be things like headaches and fatigue, people who have back pain, swelling in their extremities, mood swings, and also a very interesting one I find is itching. So you can get different forms of itching through pregnancy.
Yeah, this is one thing I can vouch for. I've had a number of patients with this. They get, and there is a special name for it. It just escapes me at the moment, but yeah.
Yes, it's a handful. It's pruritic urticarial
yes,
papules.
That's right. And it just responds so well to those gallbladder points on the side of the leg that treat the itch. So,
yeah, absolutely fantastic. Yeah. I had a lady who came in the other day. She tried corticosteroids, nothing had worked. Yeah. And what was interesting too was that they suspected that she had this particular form of urticarial papules, but she doesn't fit within their time frame of pregnancy. She was in her earlier stage of pregnancy and she had it. So they were scratching their heads. Anyway, we gave her the treatment because she was blood deficient and it was generating some wind, so we treated her for that. And she messaged me the next day with photographs of before and after the treatment, and she'd improved by over 50% in one treatment, and she was so happy because she was at her wit's end with the itching. So we could do all sorts of things, which is really nice.
But before you mentioned before about blood deficiency. Now, of course, anemia can be quite common with many women going through pregnancy.
Very common.
What about that? Can you explain a bit and tell us a bit about that?
Yes, sure. So iron deficiency can affect lots of people within our population, but within pregnancies, it's more common to happen in about the 20-week mark, when women's blood volumes will increase to accommodate blood, and also in their last sort of 4 to 6 weeks of pregnancy. And this is because the baby starts to lay down their own iron stores, and so they're sucking it across from mum. So we have a much greater need for iron in pregnancy than we would normally. And a lot of women become iron deficient when they are not absorbing things properly, or their foods are not iron rich, or perhaps they've had issues with iron deficiency in the past, or maybe they have multiple fetuses, so say we're having twins. And also if they've had a history of miscarriage or pregnancies in a very short space of time, or blood loss, that's going to mean that they're more open to having anemia. And it's really important to address it because it lowers, if you have anemia, it can lower the immunity of both mum and bub. And it makes you feel tired and get palpitations and you look pale and you just feel pretty disgusting, really. And Western medicine will very commonly give supplements of iron, and sometimes they will give you diet and lifestyle advice. And that can include things like eating more red meat, and spinach, and blackstrap molasses, and also making sure that you supplement things with vitamin C, because that's a really good a supplement that helps to absorb the iron. So it's really important, because some women will just be taking iron. It doesn't make any difference to them. They need to be taking that with something else to help with the absorption, otherwise they waste their time. But from a Chinese medical perspective, we generally understand anemia as a Qi blood deficiency. And so we work on boosting the kidneys, because if you remember, kidney essence transforms to make blood. And also we work to tonify the spleen, because the spleen transforms and transports food and drink from the stomach to then make the Qi in your blood. So we really need to focus on boosting that blood production in the body. And commonly when people have anemia, particularly our ladies who are going through pregnancy, it will affect the heart and the liver. So you'll have different symptoms that show up with those. And I have a stock standard treatment. I tend to work on using Gershus, so bladder 17, and Bisonlee, stomach 36, and I'll use that with Moxa. So once again, patients come in, we give them the treatment, and then I will give them Moxa to take home with instructions as to how to achieve it. Obviously, for bladder 17, you're going to need someone else to do that. We can't reach that there. But the course of treatment has been found to be really effective in aiding iron absorption. So it's really worth looking into.
Now, what about the sort of the mental, emotional aspect, because many women that I've had, they've never had a day depression or feeling flat in their life, and then they get pregnant, and then they're suffering, serious depression when and ideally it should be the happiest time of their life. What about the acupuncture there with working with that? What can you tell us there?
Well, it's going on the same route as we were saying before. When you're pregnant, you are open to deficiency quite commonly. You can have excesses that pop up as well, but generally speaking, you have a delightful little munchkin inside you who's sucking you dry, and so that is going to deplete your yin, it's going to deplete your blood, your qi, etc. And those imbalances in the body have a direct impact on various organs, or the energetics of the organs in the body, and therefore emotions. So in Chinese medicine, we associate emotions with different organs and then for different functions that go on. So, for example, the spleen is associated with worry or pensiveness, and the liver is more associated with frustration and anger. So if you have an imbalance internally, then that can affect the emotions.
And that must be about 99% of all the patients.
Pretty much, yes. I've had a very, very small number of people who've never had an emotional impact at all. It's quite funny. Yeah. So we basically work to rectify that balance within the individual and make sure that the organ is doing what it should be doing, and that has a flow-on effect to the emotions. And it's very, very helpful for boosting mood. In fact, it's really good for if you have acupuncture through pregnancy. Even if you don't have anxiety and depression, they've actually shown that postpartum you have a smaller risk of developing postnatal depression and anxiety, which is a wonderful thing.
Yeah. Now, what about again? And many of my patients I've seen, during the pregnancy, is high blood pressure. Mm-hmm. And now, can you tell us a bit about that? And does acupuncture help, or what's your experience with that?
Yes, it can help quite remarkably, really. So following along that idea of deficiency, a lot of women will use their yin up during pregnancy, and especially if they've had multiple pregnancies, they have less yin to give. And the understanding of hypertension in traditional Chinese medicine is generally that it's caused by a lack of yin, usually of the liver or the kidneys. And when you don't have enough yin, you can't anchor that yang energy, so the yang energy shoots up and it raises the blood pressure. So what we need to do is we need to calm that yang energy down, but then we need to actually nourish that yin to support it, to prevent things from happening in the future. The difficulty is that when we get to pregnancy-induced hypertension is a little bit more complex. And from a Western understanding, you will end up, or can potentially end up, with something called preeclampsia, which is when you have protein in the urine and you have edema as well as the high blood pressure. So what we need to do is, once again, as we would treat any person, we would work out what the imbalances are within that specific person and treat them for that. But what they found is that if you can treat women who have this hypertension in pregnancy, particularly early on, then we can actually help to drop their uric acid levels and bring them to normal and help to stabilize the liver enzymes and bring the swelling down, as well as the pregnancy hypertension. I had a lady years ago. I remember I wasn't long out of school from acupuncture school, and I'd been treating her for a back. She came in really distressed one day, and she said that basically she'd been diagnosed as having preeclampsia, and they were going to induce her. And she wanted a normal natural birth, and she was really stressed about it. And I said, well, let's just give you a couple of points and see how we go. And she came in the next week with a grin from ear to ear. And all I had done was give her little points on the back of her ears to help with bringing her blood pressure down. And the doctors were at a loss. They said, we don't know what you're doing, but whatever you're doing, keep doing it, because your blood pressure is fantastic. And she was as happy as Larry, went on to have her baby as she had planned, no complications, everything fine. So it can be really, really effective.
Yeah, now, and just sort of to finish off the show, I know that many practitioners now, like yourself, are specialising in treating, women's problems and, fertility and so forth. But quite commonly, a lot of acupuncture practitioners now, they're doing the 1 month protocol before the due date of the baby. Mm-hmm. And I know there have been a number of studies on this where they've said that, I think if you have 4 treatments or 6 treatments in that 1 month before the due date, There's less late pregnancies, there's less, long birth rate and survival rate. Everything is improved. So
very much
you want to
so.
just very quickly just sort of tell us about that protocol or just your experience with what you're doing there?
Absolutely. So normally from about 36 weeks onwards, we'll get my patients to come in once a week, and I generally just call it pre-birth prep. So what we're aiming to do is to ripen and dilate the cervix in preparation for birth, and to help to soften and support the ligaments as well, because they've been holding baby up for a long time, and now they're going to have to swap and change to push baby out. So it's a good way to just help the body transition. In addition to that, it's very good at helping to just calm the stress and the shen down, because commonly as we get closer to time of birth, women start to get quite anxious and stressed, and it's a really good way of just helping them to deal with what's going on. They feel a lot better for that. And in addition to that, we help to supplement their chi and their blood to just make sure that they have the reserves that they need for the labour and afterwards, as well as just helping them cope with what's going on at the time. So I have a general protocol of points. I use stomach 36, gallbladder 34, bladder 62, and spleen 6. And depending on the comfort and positioning of the patient, I'll either do it where they're lying on their side, so I'll needle them unilaterally, or if they're in a comfortable position in the chair, I'll put it bilaterally. But it also depends on their energy levels and things as well. So once again, you always treat the patient not just with a basic idea of this is what we do and therefore we apply it to everybody, because that's not Chinese medicine. We'll do from about 36 weeks onwards. But if the baby has not really put itself in the right place, so if we're in breech or maybe just not fully engaged, then we can also have an effect there. If baby has been shown to be in breech, then I will generally get my patients to come in from about 34 weeks, because it gives us a little bit more time. There's a little bit more room for bubs to move. So babies can move as late as 40 weeks. So it just gives us a little bit of time to work on breech if we need to, and just address the individual needs of the patients. But it's a really helpful thing. And as I mentioned before, having this treatment helps with reducing the rate of postnatal depression as well.
Fantastic. Listen, we will need to finish up here, Sarah, but I've selected a very good song for you by the Eurythmics. Women are doing it for themselves. So
perfect.
That's like a congratulations to you. Having a career change and then doing a degree and then getting out there in the real world and having a practice. And yes, I think the residents there in Whakatane will be very happy for you that you're there.
Oh, thank you, Heiko. It's a pleasure to do what we do.
All right, all the best. See you.
This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.